indeed a pleasure to introduce to you Governor Carter.
Thank you. Thank you very much. Thank you very much. To Dr. Doris Roberts and to my good friend and constant advisor, Paul Connolly, to nonpartisan and very discerning friend from North Carolina, Eileen Cooley. Thank you for that. To President Hilbert, to Congressman Claude Pepper, who's sitting in the front row, and to all of you, I'm very glad to be here. It's true that I was raised by a nurse. My mother this year is 78 years old. She's devoted her life to caring for other people. Nothing would please her better than to be here with you today. However, it happens to be Amy's birthday, and this takes precedence, I'm afraid, over even in professional enjoyment. I'm thankful to come and make a statement as a prospective president of our country about a subject that is so important to me and to you and to 215 million other Americans. There's a great deal of concern and confusion in our country about what ought to be done about health care. I tried to think of a story that would illustrate the point. I'm not a very good joke teller, but the only one I could think of was about two young boys who grew up in a very strict family, and they had their language slowly degenerate in the absence of constant presence of their father. And one night they were in the room by themselves, and their daddy happened to walk by the door, and he heard them using some language that was very embarrassing to him. And he wanted to be sure that when his sons grew up, they would not be embarrassed by language used in magazine interviews and so forth. So he went in. So he went in and told them, boys, I don't ever want to hear you use slang language in this house again, in my presence, and particularly in the presence of your mother. And if you do, your punishment is going to be instant and severe. Well, the boys said their prayers and went to sleep, and they were determined that they were not going to use language, but they had developed a pretty strong habit. So the next morning they got up and went out to breakfast, and the first thing the older boy said was, pass me some of them darn grits. His father didn't say anything. He just reached over and slapped him alongside his face and knocked him on the floor. And his younger brother was sitting there, and he looked down at his older brother lying on the floor. He looked up at his father, and he thought a while. He looked down at his older brother and looked up at his father, and finally his father said, well, son, what do you want? He said, I don't know, Daddy, but I darn sure don't want one of them grits. I know that. Well, sometimes when you have the best of intentions and really want to comply with instructions and commitments and ideas and ideals, there's a great deal of confusion about what needs to be done. And that's the case in our nation right now, as we, the greatest nation on earth, struggle with the problem of how to let our own country provide healthy bodies and minds for our people. Let me say at the outset that I share your deep concern that all of you feel about the state of our nation's health. And after January the 20th, I intend to provide the aggressive leadership that's needed to give our people a nationwide, comprehensive, effective health program, and you can depend on that. This year, we will spend over $130 billion on health care. That's an average of $600 per person for every man, woman, and child in our country, or for a family with a wife and a husband and 2 children. $2,400 of their income will be spent on health care. And still there are 14 other nations that have a lower infant mortality rate. And we know that the cost of health care is projected to double in the next 5 years. We lead the developed nations in the incidence of heart disease and cancer. And we still have especially severe health problems among the poor and particular members of minority groups who also happen to be poor. We have excellent medical care for the very few who can afford it and who are educated enough to get doctors' advice in advance. But we have an inadequate health care program for those who are not well educated and for those who cannot afford expensive care. In short, there's a tragic gap between what our national health should be and could be and what it now is. Our technology, in many instances, has outstripped our basic humanity. Sophisticated and costly medical technology has improved our health, but its duplication and misutilization has wasted our nation's wealth. And the scarcity of financial and human resources then restrains the budget for other health and social needs. It's time for us to get back to the basics. And the basic need of any health care system is to care about people and to prevent disease and injury before they happen. I'm sure you agree with this. Now, prevention is both cheaper and simpler than cure. But we have stressed the latter, cure, and we have ignored to an increasing degree the former, prevention. Our traditional self-reliance, our emphasis on family and community health, our concern about a prevention of disease, regular checkups, early diagnosis, early treatment, has almost been forgotten by many in the onrush of technology and increasing specialization. In recent years, we've spent 40 cents out of every health dollar on hospitalization. In effect, we've made the hospital the first line of defense instead of the last. By contrast, we only spend 3 cents on disease prevention and control, less than half a cent on health education, and 1/4 cent on environmental health research. Now, I grew up in an isolated community of Archery, Georgia. We didn't have electricity, we didn't have running water, but I had adequate access to public and private health care, not just from my mother. But the major interrelationship that I had with doctors and nurses was to prevent disease. And those of you in the audience who are as old as I am remember the threat of almost sure death from many of those horrible diseases: diphtheria, cholera, polio, mumps, measles, whooping cough, typhus, typhoid. But the emphasis that was in my life on health care was not to wait until after I got sick, but to prevent my getting sick. That emphasis in the last 40 years has been lost. It needs to be restored. Look at our record in recent years of immunizations. In 1974, 37% of all our children of age 1 to 4 had not been immunized against polio. 44% had not been immunized against rubella, and 40% had not been immunized against measles. This year, as you may know, we've already had reported over 35,000 cases of measles, and that's a national disgrace. This year also, as you probably know, President Ford proposed to cut the federal spending on vaccine for immunizations against preventable diseases by 50%. This, of course, is no surprise to me, because for almost the last 8 years, the Nixon and the Ford administrations have slashed one essential health program after another in the fields of maternal and child health, community mental treatment centers, health manpower, health maintenance organizations, occupational and environmental research, and health and biomedical and many other fields. That kind of negativism about preventive health care is going to stop next January the 20th. I just want to give you one more tragic example of the failure of preventive care. The Pap test was devised in 1943, but as late as 1974, the last reported period, fully 25% of our nation's women had never had a Pap test, and thousands continue to die unnecessarily from cervical cancer each year. That's a failure of leadership. It's a tragedy that strikes unequally and unfairly at those who are most ignorant, poorer, and who very seldom have any interrelationship with a doctor until after they get seriously ill. We ran an analysis in Georgia, as those of you from Georgia know, to determine the 10 most severe cripplers and killers of our people: heart disease, stroke, cancer, and so forth. One of the shocking discoveries that we made was that among black women in rural counties, there was more than 20 times as much cervical cancer as among white women in urban counties. The only difference being access to early diagnosis, regular physical examinations, and preventive health care. We need to stress the right of all people in this country to prevent the cripplers and killers that can affect their lives. A vast amount of our ill health is caused by the way we live, as you know better than any other human beings in this world, by the environment we've created, by the lifestyles that we've adopted. It's not the role of government to dictate lifestyles, but it is a proper role of government to educate our citizens and to aggressively stress the promotion of good health. The biggest killer of our young people is not a disease, but accidents, mainly automobile accidents. It should not be beyond the capacity of a concerned society to reduce those needless deaths and maimings. And with the breakup of the family structure, we've now seen evolve among young men 15 to 20 years old that the second most severe cause of death is suicides. This is a shocking thing in a society that's always depended on the family, the community, stability, care, love, but we've seen it broken down. The major killer of middle-aged men is heart disease, often brought on by overeating and smoking and a lack of exercise and a lack of knowledge. It should not be beyond the capacity of a concerned society to reduce those unnecessary deaths. The fact is that if we would improve our national eating and drinking and smoking and exercise habits, we could be healthier, be happier, live longer, and save ourselves billions of dollars in the process. I think again, presidential leadership and the tapping of the tremendous resources assembled in this ballroom could lead us toward that reduction in unnecessary deaths. We must be concerned, too, about environmental and occupational health threats. Environmental factors such as smoking, synthetic compounds in our food and water, exposure to industrial and commercial chemicals, air pollution, now cause an estimated 70 to 90% of all lung cancer. We've discovered cancer hotspots where industrial pollution causes dramatic high cancer rates. Yet for 8 years, this Republican administration has failed to enforce legislation and has opposed new legislation that would reduce the pollution that is killing our people. That's a failure of leadership, again, and it must be stopped. We've also got an opportunity to cut down on the incidence of stroke. As you know, the Communicable Disease Center for the entire world happens to be in Atlanta, and we worked very closely with them while I was governor to determine how best to control or to minimize the impact of stroke. We've got about 600,000 people in Georgia alone who are potential stroke victims. And we found that with a simple blood test, cholesterol analysis and a blood pressure test, we could identify those who might have a stroke. The total cost, $3. And we could just tell the person, go to your local family physician, you might have a stroke, take simple medication to prevent this debilitating affliction. It costs thousands of dollars, as you well know, for an indigent person to be cared for by the taxpayers once they have a stroke. Let me outline for you some of the goals of the next administration in the area of health. First, we must return to the basic focus on the prevention of illness and disease, including strong neighborhood and community orientation. Second, we must have a comprehensive program of national health insurance. You know as well as any group the complexities of such a program, but certain basic principles are clear. The coverage must be universal and mandatory. We must lower the present barriers in insurance policy coverage and otherwise to preventive and primary care, and thus reduce the need for hospitalization. We must have strong cost and quality controls, and the rates for institutional care and physician services should be set in advance prospectively. We should maintain the personal interrelationships between patients and their physicians, and we should give freedom of choice in the selection of physicians and the treatment centers to the patient to be cared for. Along with catastrophic health insurance coverage, we must make the provisions of prenatal and infant care benefits one of our highest priorities. We must phase in the program as rapidly as revenues permit, helping first those who most need help and achieving a comprehensive program well-defined in the end. Now, many questions remain to be answered on national health insurance. As any member of the Congress knows, as any professional health care specialist like yourselves know. And I ask for your advice and your help in obtaining the best possible program as quickly and as early as possible. The third thing we must stress is health and nutrition education. Our public schools could do more to teach our young people the dangers of drinking, smoking, using drugs, overeating, and eating the wrong kinds of food. And also, we need to make sure that the young people have a habit formed of taking advantage of the public and private health facilities that we offer. Many times, there's never that closeness of feeling to a healthcare specialist engendered in a young person's mind that I was fortunate enough to have because my mother was a registered nurse. Fourth, we must mount a renewed attack on cancer and other diseases caused by toxic chemicals in the environment, including strict enforcement of the new Toxic Substances Control Act, which has just been passed. Fifth, we must continue and expand biomedical research and be sure that it serves the health needs of all our people, and we must have, and I intend to provide, government reorganization that will end the bureaucratic fragmentation that now frustrates any hope for a rational and effective national health policy. This is crucial and must be done. It would be almost impossible for any of you to name a single major federal agency that doesn't have part of the responsibility for health care. We've got 302 different federal health programs. They're scattered throughout the federal government. There's no coordination, there's no cooperation, there's no careful planning, there's no end of duplication and overlap and waste. Medicaid is in one agency, Medicare is in a different agency. Neither one of those is responsible for health care. The certification of the quality of care is in a third and different agency altogether. So we need to consolidate and reorganize the federal government to make sure there's a clear delineation of responsibility, a clear assignment of authority, so that our professionals who work for the government at all levels can let your professional careers be spent in the most fruitful way for a change. That must come. It's going to come next year. We must encourage, and you can certainly help with this, alternative delivery systems, such as health maintenance organizations and rural group practices. We must also remember that it's both more cost-efficient and more health-effective to use less expensive treatment methods where possible, to improve outpatient services instead of overbuilding and overusing hospitals. And in one recent analysis in New York City, the average length of patient stay was 13 days. For the same disease or affliction in hospitals in California, the average stay was between 3 and 4 days. There was twice as great a chance of being operated on in New York as there was to be operated on in Michigan for the same reason for entering a hospital. I'm not saying this to criticize any particular community, but just to point out to you that the standardization of treatment facilities and a heavier and heavier emphasis on outpatient treatment and minimal health care comparable with a disease or problem is something that we have a long way to go in this country to realize. But I think the fact that the insurance companies, the hospital, the nursing home, the doctors, the nurses, and the patient's family all cooperate to hold down the cost of what care there is and to give adequate health care without wasting our scarce resources is a great opportunity in the future. Eighth, we must clean up the disgraceful Medicaid scandals. That is important. That must be done, and that will be done. We must encourage nursing home standards of safety, sanitation, and care, and we must encourage programs that will serve elderly people in their own homes whenever possible. We must, by scholarships, by loans, and by other means, provide medical education to more students from minority and low-income families and also for more women. And we must encourage young health professionals to train and practice in rural and inner-city areas. Now, in some countries, there's been a dramatic recent shift toward more women becoming medical doctors. This really ought to be done in our own country, and I'll do all I can to help with that. As I said in a recent speech to a women's group, I want Amy to grow up feeling that she can be a lawyer and not just a legal secretary, that she can be a medical doctor as well as a licensed practical nurse, that she can be a president instead of just a president's daughter. And I think this is an attitude that we need to maintain. We must remember, too, that a nation's physical and mental health cannot be isolated from its economic health. And we must therefore end the present Republican economic policies that have brought us at the same time both inflation and unemployment, and in the process have made it impossible for millions of Americans to afford decent health care. Now, these are some of the goals that I will work toward if I'm elected president in the health field. I don't claim to know all the answers. The answers are not easy. Our nation has struggled unsuccessfully for many generations, and we have failed where other nations have succeeded better. This does not require that the government run the entire health care program in our country. I would not favor that. But there needs to be a close cooperation between public and private health care delivery, an emphasis on prevention of the cripplers and killers of our people, an adequate financing of health care, a shift toward non-hospital treatment whenever possible, and a realization in our country that it is a great saving to be derived economically if we can address this problem consistently and with forethought and with a deep national commitment. These things must come. Now, I do know that good health ought to be a right and not just a luxury, and that good government has no more responsibility that's solemn and of deep concern than to make possible good health for all its people. I think that our people are ready for giant steps forward toward a comprehensive and adequate national health policy. I think we stand on the threshold of an exciting new era in American health. We have the technology, we have the financial means, we're already spending the money, we have the professional knowledge, we have the deep concern that's revealed in every poll that we run. The American people put number one when you ask a question, what in your lives is important enough even to raise taxes if necessary? And the people's response is always health care. It's of great concern to those who need it most, and it's time for us to do it in this country. I ask your support, I ask your advice, I ask your cooperation. I'm one of the non-professionals in the health field who's had a chance to learn within my own family, as a chairman of a school board in a backward and rural community, as one who's worked closely and lived closely among poor people, as one whose mother has devoted her life to health care, as one who's been governor of a state struggling to overcome the health problems of our people, and as one who's seen the brightness that can come in a person's life when, for the first time in their existence, they can overcome a physical or mental defect which could have been and should have been detected and eliminated in the early years. And as one who hopes to be president of the greatest nation on earth, I pledge myself to combine my efforts with yours. Although I don't know the answers, people like you know the answers. And I look forward to forming a partnership with you to give our people a long overdue opportunity for simple and basic prevention of physical and mental cripplers and killers of the American people, which can finally be realized if we cooperate, if we tap the resources of our country, if we realize the difficulties and face them frankly and courageously, if we don't yield to discouragement, if we can commit ourselves to this most worthy of all social efforts to let our people take full advantage of the opportunities God gave them in our great country. Thank you very much. I've enjoyed being with you.
you.
I'm with you, too.
Yeah.
Goodbye, everybody. Goodbye.